Hello, Professor and fellow classmates. My name is Jerry Schramm. My presentation is on universal healthcare in Great Britain. Can you imagine a healthcare system that covers everyone? No premiums, no co-pays, tax-funded, integrated medical, community, and social services, and all driven by patient satisfaction. The National Health Service, known as the NHS, is the healthcare system of Great Britain. It's supported through taxation, covers everyone, and has no premiums or co-pays. It's comprised of a number of organizations that collectively provide service to over 1 million patients every 36 hours. The main organizations of the NHS are Parliament, Department of Health, Secretary of State, and other government departments. The role of the primary care physician. The British terminology for the primary care physician is a general practitioner, or GP. It's the frontline medical professional in the NHS that triages and arranges care services for the patient. This is the first person that a patient will see in their health care venture. They can't do anything unless they see the GP first. They're the gatekeepers, over 36,000 GPs working in 8,300 practices in England. All patients must first see the GP before having access to any specialized services. They can handle many services through their practice, but will refer patients to specialists if warranted. They have the right to choose between the types of care and who provides that care. So the GP would be the one who arranges the care, decides which care needs to be done, and which specialist to see, although the patients will have the opportunity of selecting from those specialists that are available who would perform their care. The GP expectations, they're government employees, paid a fixed amount based on the number of patients they have. They're expected to meet quality expectations of good medical outcomes, safe care, and good patient experience. The priority of patient care is measured by how the patient perceives the care administered rather than the procedure itself. One example that was offered during the research that I had was hip replacement. So if a patient had a hip replacement, rather than just suggest that the hip replacement was done appropriately from a doctor who performed that operation maybe 100, 200 times, the idea is to determine how the patient perceives that hip replacement. Does it allow them to have the quality of life they expect? Does it have the pain tolerance that they expected? All the things that would suggest that the patient is in control and they're a consumer, with customer service being paramount. The GPs have the ability of participating in a pay-for-performance bonus program. Depending on the number of points earned, coordination of service, patient satisfaction, available services, they can earn a bonus based on the patient outcomes, whether or not they're positive or negative. Positive leads to the bonuses, and obviously the better the patient satisfaction, the more services that are coordinated, the better the patient experience, the more money a GP can potentially make. The NHS services, most services such as hospitals belong to a trust or foundation trust. They're similar in design to the US ACOs. Each trust can have multiple sites or hospitals associated with that trust, and they're composed of boards of directors to oversee the trust's activity. They're held accountable by council of governors elected by the public. These trusts are collaboratives between hospitals that formulate health systems, and they're governed by boards of directors to ensure that the quality is appropriate, and the council of governors are elected by the lay public, patients, family members, staff members of the respective facilities, all like the governors who hold the boards accountable. The Clinical Commissioning Group, they understand the needs of the community, and the funding necessary to address those needs is overseen by the Clinical Commissioning Group. They consist of a GP, a nurse, secondary care representatives, and a minimum of 2 lay people. The objective is to coordinate the care in the community, determine which providers are available, and the quality of those providers. They secure resources for hospital care, rehabilitation, urgent and emergent care, most community services, maternity services, mental health and learning disability services. They review the performance of providers who provide the service and select or terminate relationships dependent on the provider's quality and outcomes. So providers who don't measure up, get poor patient satisfaction, will not be providers who are selected by the CCG. So they only select providers who meet those specific parameters according to the NHS Constitution. The NHS Commissioning Board is better known as the NHS England. They oversee commissioned services for more appropriate at the national level, such as military care services, and are responsible for commissioning primary care services, including the GPs. Quality oversight. The Care Quality Commission provides oversight and investigates allegations of poor performance. All providers must register with the CQC to provide services under the NHS, and every upper tier and unitary local authority in England has arrangements with the local Health Watch to get feedback and provide that feedback to the Health Watch England for review. So the idea is that patient feedback drives the providers and determines whether or not providers are administering proper care or less than appropriate care, and then to put sanctions or fines on those particular providers or prohibit them from providing service under the NHS. Other NHS services: Public Health England, tasked with major public health concerns like avian flu or SARS. Department of Education addresses national children's social care. The Health Education England, responsible for training and educating healthcare workers. And Health and Social Care Information Center collects data, provides support to healthcare providers, and assures patient confidentiality. The history of the NHS. 1911, Parliament passed the National Insurance Act, which deducted a percentage of an employee's pay for primary care medications. This covered employees only and non-dependents. In 1944, the Minister of Health, Bevan, with party control of legislative and executive branches of government, due to Parliament regulations that the winning party has control of both legislative and executive branches, it allowed him to create a tripartite system which separates the services in the hospital services, primary care, GPs, and community services, and ultimately formed the NHS. Margaret Thatcher, she had some additions where she transferred the NHS from a public service for sick patients to more of a consumer-driven public system of purchasers and providers. And in 1990, she passed the National Health Service and Community Care Act, which established trusts to manage the hospital care and maintain quality. Under Tony Blair, more reform continued. He infused more funding into the NHS. He replaced waiting lists with appointments, imposed quality standards overseen by the government, and united special care, primary care, community care, and social services into comprehensive integrated services. So he infused more money, was able to integrate and bring all of those services under one united front, so that quality could be pushed out to the patients, decrease those wait times so that an appointment would hold true rather than standing in long lines, which were all viewed as negatives under the NHS. Policy creation and oversight. The Department of Health leads, shapes, and funds health and care in England, the only body with oversight over the whole health and care system. And they create and update policy and legislative framework in which the health and care system operates, accountable to Parliament and the public for the effectiveness of the health care system. The Department of Health is the overall body that drives the NHS. The Secretary of State for Health is accountable to Parliament, provides direction for the NHS, and holds all the national bodies accountable for their performance, and ensures all aspects of the health and care system work together. He works in collaboration with the Department of Health to ensure that every aspect of the NHS is reviewed and all held accountable. The NHS England oversees the commissioning process, monitors performance of the CCGs to assess budget, engagement in the community, and adherence to the NHS Constitution. Any major changes always must pass 4 tests. It has to have public and patient engagement, consistent with the patient choice, clear clinical evidence, and support from clinical commissioners. Independent from the Department of Health, the idea is that the commissioning process selects the providers and assures that the CCGs are selecting appropriate providers at the community and municipal level. Additional contributors, the Care Quality Commission assures safety and quality. Health Watch England supports local health watches. Health and Social Information Center maintains the IT network and patient confidentiality. And the upper tier and unitary local authorities support a health well-being board to assess community needs through joint strategic needs assessment. And they have the power to scrutinize any matters related to planning, provisions, and operations of health services in its area. Essentially, the government has such a large, expansive population to serve that they've broken down the health allocation into smaller communities and municipalities so that there's some direct oversight, and then those individuals, those leaders in the communities have the ability of then driving the healthcare to meet the needs of their particular community. Some changes in the NHS. Monitor, it's a division that oversees the NHS Foundation Trust and ensures that quality services are provided effectively, efficiently, and economically. Beginning in 2014, all providers receiving funding need a license issued by Monitor to operate, and working in collaboration with NHS England, they set a series of prices for NHS services. The NHS Trust, the government intends all services in hospitals currently NHS Trust to become NHS Foundation Trusts. As of May 2013, there are 144 Foundation Trusts and 102 NHS Trusts. Again, I want to offer that this is very similar to the ACOs, and that having these different collaboratives unite and merge to provide healthcare systems. Quality and Outcome Framework. In practice since 2005, incentives for providing quality. GPs are paid fees based on their points, organized practice, patient view on their experience, the extra services offered, and how well chronic diseases are managed. It's voluntary, but most GPs participate in the additional revenue. These are the bonuses that we spoke of earlier, where dependent on how these particular GPs are rated and their practices are rated, they can earn additional revenue. The British NHS model offers a number of positive aspects the US could benefit from. The government negotiated pricing, offered free healthcare through taxes, is similar but different model compared to the ACA, where the ACA uses more of a private system to get everyone insured. The NHS uses a government negotiated system. Preventive medicine is well regarded in the NHS model because GPs are rewarded based on management of their patient's illness and the feedback from the patient. So basically, when the patients are treated well, they receive appropriate care. Their feedback is positive, and the GPs are rewarded with bonuses. The idea is a healthy patient rewards the GP for practicing appropriate medicine. The downside is it's tax dependent. As the rising medical costs go up, obviously taxes are going to go up. The gatekeeper approach with the GP having so much power, it's a bit intimidating. And a system with no co-pays, premiums, and free access to healthcare regardless of employment or social status, it certainly has quite the appeal. A list of my references. Thank you.